So I'll go through our standard company presentation, but feel free to jump in and ask questions about the challenges around the grant funding strategy, how we built the company. And I think this is an interesting example of how to survive in today's really difficult market for funding, and how you can use grant funding to create opportunity to build and refine your product market fit, which is really critical when you're moving any kind of academic, created technology, novel technology with no precedent into the market. So postpartum depression, huge societal issues, right? Falling birth rates. People don't really appreciate that, with a reproductive rate of less than 2, that is not just like simply inconvenient for the human race. It just means in 5 generations we'll be extinct, right? Think about it. So in that process of creating a baby, you have to think about that humans are born with immature nervous systems. There is no well-adjusted baby without a loving mum. It doesn't have to be super mum, but mother needs to be there for those first 2 or 3 years of development of human babies. Otherwise, you end up with irreversible damage, lifelong challenges for that child, attachment issues, ADHD, depression. So creating an environment for mother to be supportive and helpful for the child is actually of strategic importance for everyone in this room. We may not be married, but we all had a mother, right? Single one of us had a mother. So the mom is the most important thing for us right now. But despite that, there's very little classic VC interest in developing a diagnostic to treat this population. Always the pushback from investors today is reimbursement. How can you get this reimbursement? And then the reticence of developing a standard of care, reimagining how care looks. So this is a snapshot of how we kind of built the company, thinking first about technology, what we developed, what was the success factors that led to successful grant writing collaboration with FreeMind. Well, actually it was because the technology was incubated for almost a decade in the academic environment. That enabled us to develop peer-reviewed validation. So several different clinical studies, 600 people. The validation studies are really critical because as you develop your grant writing strategy, we all know that the primary objective there is for people to rule you out, why they have came up with a smart reason why they can't fund you. So building that clinical evidence is critical. The second thing that made our strategy successful was working with FreeMind strategic advisors to really understand, here we're really looking for the fit of the RFP, what the government was looking for, and what we were producing. So there really is no point in submitting grants that are not 100% aligned with what the program officer is looking for. So think about it from that perspective. You really have to align what you're doing with what they want you to do. If you do that, though, you can see that we create this opportunity to build a company. And through the traction from FreeMind, with $10 million, that was the biggest, most successful kind of determinative factor for the company. Not just from the Department of Defense, which actually funds all of our clinical validation work, also early work from NIH and the RADx program, Rapid Acceleration of Diagnostics. So having awareness of these programs you can jump into actually powered the development of our technology, powered the development of enhancing our product market fit. Now, the technology that we're going for is really focused on postpartum depression, but that's really the tip of the spear. And I think everyone's familiar with this kind of general concept of land in a small market that you can control and then expand. So land and expand. So that's really where you're focusing on selling to investors this idea that you can be number one in a small niche. It may not be a massive market, but it gets you traction and then you can expand. So in fact, the biomarkers we measure really create an opportunity to understand hormonal sensitivity. So most of us are blind to the hormones that are changing in our circulation, impacting our behavior, both men and women, right? But if you can understand how your perception of reality is being changed by hormonal changes, and some women and some men actually are very sensitive to this, you can actually predict postpartum depression, the susceptibility that you'll be more sensitive to stress and anxiety, and also other areas of even bigger opportunity, for example, perimenopausal depression and PMS. So really, really important concepts. So the beachhead opportunity. We're thinking about this as what is the big problem we're trying to solve, reimagining postpartum care. As I mentioned, it has strategic importance. That's why the government is interested. A lot of people ask, well, why the Department of Defense? Why that? Well, they're the largest employers of women in the US, actually. And they're really interested in two things: keeping people in the armed forces and helping them to stay ready, battlefield readiness. So it fits in nicely with their idea. This is a big unmet need. It drives a ton of additional value. And I would say in our test marketing, women really want this. Women want empowerment to be prepared for pregnancy, and they want to have a clear mandate to talk to dad and their family that this is not just all in their head. This is something that they need help with. Like mental illness and behavioral health is really challenging because it's not like a broken bone, right? You can't say, I've broken my leg, I need help. So you have to admit something unpleasant and uncomfortable. So a biological driver for this is super clear. And the fact that we have what's now kind of precision psychiatry or biological psychiatry, where we can identify exactly what the cause is and how to treat it, means that we really drive a really interesting kind of business opportunity. 2 million a year, 3 million babies a year born. Selling a kit to all of those at $300 a kit gets you a market opportunity of $600 million. But first, you have to kind of get through that commercial launch piece. What was interesting in our journey is that women were very specific in their feedback to us that they didn't want a code analytical scary test result. And they definitely didn't want to be put into a bucket of disorder or vulnerability. What they wanted was a solution. Right? So the whole creation of my Luma brand is just like a high-end perfume. It doesn't matter what your test result is, we've got your back. And so you take away the fear and anxiety you create, and we're all living in a human interface of, we don't want to admit scary things about ourselves, even though they're true. We want solutions, actionable solutions, and this gives an actionable result because there's actually FDA-approved drugs. But how you talk to people, all of this is really a long journey of product market optimization. As I mentioned, we've been involved in this, or our academic co-founders, from almost a decade, building that body of evidence that your reviewers are going to review. And I'm happy to say we're at the point when we applied for the grants that we're pretty much ready to move towards FDA approval with registrational studies and then broadening the opportunity to saliva-based testing and then 6 weeks postpartum. So really enhancing the opportunity there. So what have we done with that work? Really built a complete holistic solution, reimagining how that process works with some key milestones that investors want to see, right? The idea that we can actually get approval by 2027, that puts us almost, within this sweet spot of when FDA approval within 24 months. Even though investors are reticent to move forward with diagnostics, that's kind of a sweet spot. If we can get within 2 years of FDA approval, then you start to see the opportunity to get kind of really better funded. And then, of course, the kind of platform-based innovations expansion I mentioned into every kind of endocrine transition in women is another opportunity to help identify better solutions. The key here in terms of success of the company is really thinking about what do the patients want, how do we help obstetricians, gynecologists? And when you think about that system, and we were really shocked when we talked to obstetricians, gynecologists, they were desperate for solutions, and we thought we would have to give them a cut of the kit and the cost and all that stuff. Actually, they just want to help take care of mom. We're fully overloaded. We're just surviving in today's environment in obstetricians, gynecologists. Average age of an obstetrician, 55. No one's going into that business. Less and less people. No time to talk about mom because they're really worried about baby. So they actually wanted a complete solution. You handle mom. You take, because, that would really help us the most. So it's really creating this ecosystem of secureness and survival where we're working with a partner to provide all that holistic help for mom. And then for payers are really going to come into play later. This is really about healthcare economics. How do we save of that $17 billion? That comes down to optimizing what's called your CPT track, your stack of codes you can use to reimbursement. There's 2 codes we can use today before we get FDA approval that allows us to get reimbursement for baby wellness and navigation services. So understanding the kind of reimbursement landscape, absolutely critical. And then partners, the thing you need to understand with partners is that is a long haul. You have to do SOX 2 compliance, electronic healthcare records, HIPAA compliance. You're not going to do that in startup mode. So that is, several years of development and building relationships. In our case, we have a relationship with Mayo Clinic. They're interested in developing this test in the reference lab. So it creates an opportunity to build this. But all of this stuff give you time and money to think strategically about building your own companies. The other critical element is an experienced team. I am an innovator, serial innovator, been involved in several different successful companies, but I'm not a commercial person. So one of the most important things I would say to founders in the room is, at some point, think about your succession plan. Rashmi is a commercial operator, I'm not. And you have to know your limitations. And I would say it's amazing to me how many investors say to me, thank the Lord that Andrea is stepping down and finding someone else new. You might be threatened by that, but it's actually the right thing to do to build your technology if you're interested in really getting out there into the mainstream. And then kind of just thinking about the investment opportunity here from how we solve the problem, how the science works, the market opportunity and the solution. Oh, sorry, that was the last slide. Anyway, I'll maybe stop there and open up for questions. And you can always talk to me afterwards, should you wish to. Yeah, so classic investor question, where do we make money? So we make money on the kit. So we sell a kit for like $300. COGS, the cost of making a kit, is about half of that today, and we'll drop to about 20% of that with scale. So if we sold to 10% of those 3 million women who have babies each year, generate revenue of like $60 million a year. And that's kind of the revenue we would then kind of build upon Series A to get to, classically either IPO or sale to a big company. And we'll probably sell to like LabCorp or Quest, and we're talking to those guys now. Yeah, so for innovative diagnostics, you can launch what's called through the lab-developed test pathway. So that is a way that most innovative technologies get launched. So there are some restrictions. You have to prove results to the doctor, but there's lots of design arounds where you can buy tests now and get referred to a doctor and they'll order it for you. Once you set that process up, then you can start selling your kit before you get FDA approval. In our case, we'll also apply for breakthrough device designation, and that gets you kind of early access to reimbursement through what's called TCET, which is transitional coverage for emerging technologies. So all of this reg pathway and reimbursement pathway, you guys have to know backwards and forwards. But that gives us an opportunity to get reimbursement after FDA approval. Afterwards, you have to submit healthcare economic data to CMS, and that can take several years. So that gets a pathway of early reimbursement, but then you also need, in the space, like diagnostic codes. In addition to CPT codes, you need like automation codes and instrumentation codes. So all of that takes time and resources. So the non-dilutive funding is not going to solve all of your problems, but it will create opportunity to invest in the core technology and building it, and then also the validation from peer review to then hire a team that can take it to the next level. Yes, of course. I'll give. Oh, yeah. And I would say just a few other things. FreeMind is one of the most amazing groups to work with. Not just because I can go. It's not working. Not just because we were successful. The $10.5 million in grant funding, so one NIH award And then, there you go. And you can find me on LinkedIn if you Google me or search. It's a kind of the strategic thinking about, as I mentioned before, how do you align what you're doing to what the government agencies are looking for, so that early alignment of an RFP to your specific area of interest and refinement of what parts of product development and what parts of technology development fit there. That's a critical structural thing you need to align on. And that's what these guys are really good at. And I'll be around for a bit, so if you guys want to chat, feel free. Thank you.